Hi everyone. Just wanted to give another update, and I kind of want to go into more detail about what the mechanism of action of every supplement that I use or prescription that I have from Merrick Health does, and what the goal outcome of them is. So the first one I want to go over is the L-carnitine injection, and I think I want to go over this because it is a very popular supplement, or it's an over-counter, or it is an over-the-counter supplement in capsule form. Um, and I just want to kind of go over it because I think it benefited me a lot. So I think the knowledge and the anecdotal evidence that I can give um, regarding what I felt while using L-carnitine injections, and just like the overall process of utilizing that in a prescription injection form. So first, I want to start off by telling you what the vial was. So it was a 500 milligram vial, about that around normal size vial, and I used insulin syringes to I think 100 milliliter insulin syringes to draw and to inject, and I did a 50 ml injection every day before training. So pre-workout, usually about 10 to 15 minutes before I worked out, which is 6 times a week because I work out 6 times a week. So in order to draw it, you take an alcohol wipe, you clean off the top, you take the caps off your syringe, you put upside down, vial here, syringe goes in, you pull, well actually you already have it pulled, and then you put it in, and then you push the air back into the vial, and then you pull out to where you pulled it from before, whatever your prescription dose is. And then you go ahead and slowly take that out. You flick it a couple times to get the air out, and then you would wipe where you're going to inject it. Now, L-carnitine has to be an intramuscular injection, so it needs to go to a relatively shallow area or an easily accessible muscular site. So the delts were often used for me, the quads or the medial glute, or the glute medius, just because it's easiest to get to. I like doing the delts, and I just alternated 1, 2, 3, 4. But sometimes, depending on the day or what was going on or where I was injecting, I wasn't going to do it in my legs. So I would do it delt. That is not recommended because you can get some injection site soreness, and you just want to treat your body with respect and let it heal. So I would do delt, leg. That way to just keep that rotation up. Some of the effects that I felt while doing the injections were you would get some injection site soreness. I was very fortunate to never hit a blood vessel or vein, which is good. In order to check for that, you'd pull it out slightly. If you get a lot of blood, that means you're in a blood vessel, so you want to take it out and repin somewhere else. But thankfully, that never occurred for me. So the injections were always smooth, no pain. You don't get any stinging or anything like that. The most you get is like that little pinch when you're pushing it in at first. And everybody's gonna be super nervous at first when doing your own injection, but after the first week, it just became second nature. And I kind of started to look forward to it because of the way it made me feel. So to go into a little bit more detail about L-carnitine, what are the believed benefits of L-carnitine injections? Now remember, this could be over the counter, but you have to take so many pills to get it to do the same effect because of the way that it breaks down in the stomach. So L-carnitine injection is just a more efficacious way to do it, and there's less side effect profile. Meaning if you take L-carnitine orally, it could be believed to be carcinogenic due to the way that it converts in your intestines or in your stomach. So the injection is just a better way to do it. So what are the beliefs of what it can do, and then I'll go over what it did do. So L-carnitine injections are meant to promote fatty acid oxidation, accelerate the fat burning process through doing this, stabilize blood sugar and eliminate carb cravings, increase energy levels and reduce fatigue through improvements of utilizing fat as energy, improve skeletal muscle mass and exercise performance. This is probably more of like a side effect due to having more energy. Improves endurance and athletic performance. I would state that it probably does that through the energy pathways that utilize fat, and promotes faster muscle recovery, and this is through being able to utilize nutrients as fuel that you have floating around in your blood. kind of helps pull the fat into the mitochondria and help the mitochondria produce energy. And as you produce energy, everything needs energy to build within the system. So that's what it does there. Now, what did I notice? I would say that it took a little while for me to notice really any change. It wasn't like I injected and I was like ready to go, right? I think the effects of L-carnitine are cumulative, meaning you need to have like a plasma volume level or a blood volume level of L-carnitine kind of floating around at all times. I don't know what the half-life is or anything like that. But to go into a little bit more detail about what I mean there is the first week I really didn't notice much of a change besides that I was injecting myself every day. I had a little bit of post-injection site soreness and things like that. But after like a week or two of utilizing this, I did notice that I would have a little bit more energy in the gym, meaning I would come into the gym with a little bit more like fight or fire, a lot more like amped to do it. So I wonder if there was like a mental trigger, or maybe it was just because of the process of injecting. But what can I definitely say is the days where I was doing my cardio and legs, I was able to do a full hour cardio and then a full leg workout after, without any reduction in energy throughout the movements. Now after that second week, I was definitely a lot more sore than I normally is, but that's probably because I was able to do a lot more sets with a lot more intensity because of the utilization of energy. That third week, I noticed that I was starting to recover a little bit faster from my training, and I was also able to kind of push myself a little bit harder, whether it be reps or weight, depending on what the movement was. But I was able to either increase one of the two. And then I would state that that third or fourth week of being on L-carnitine, I did have the elimination of carb cravings. Now, can I say that this is only because of the L-carnitine? No, it could also be because of the mental switch of being invested in what you're doing, and being invested in your health. L-carnitine definitely improved these things. I mean, I was losing body fat, I had an endurance boost, and I noticed that stubborn areas were losing a little bit more fat a little bit more frequently, meaning like my love handles and my lower back. And there's some other beliefs that L-carnitine can help with like cholesterol, androgen receptors. So that's probably why I was getting the fire or the intensity boost, because I had androgen receptor density, which means I was having more testosterone, which can improve that kind of thing. Definitely noticed an effect on sexual health within 2 to 3 weeks after that. That definitely improved because of the L-carnitine. I don't think it would be because of anything else, but yeah. So just like a recap, L-carnitine. What I noticed was the first week not much. Second week definitely was able to give more of an output with reps or weights. Third week, my recovery time was better, and the fourth week, or third and fourth week, I would state that fat metabolism in stubborn areas was definitely better, as I was seeing drops in weight. I was also seeing an increase in sexual function and sexual health, which is always an added benefit. And I continued this for 12 weeks. So I used L-carnitine injection for 6 days a week for 12 weeks, with nothing but good things to say about it. All good effects, no negative side effects. Didn't feel anything weird from it. Didn't affect with sleep. Didn't affect muscular, like muscular cramping or hydration. Nothing. No negative side effects that I experienced. Everything was all positive. So with that, on the 15th, I'm gonna get my my next 3 months. So December 15th, I will get another 3 months of L-carnitine, and then you utilize it again to see if I experience the same effects, if they're better effects, or whatever. But I will do another three week recap to see how much more body fat and energy I can lose and energy I can have. those next 12 weeks, I'm going to really focus on bringing down body fat levels. So I'm going to tweak the training from 6 days a week to doing push legs pull with only cardio on the legs days. I'm going to do cardio on the push and pull days. So I'm going to do cardio 4 times a week, and legs will no longer have a cardio day. That cardio is going to be 40 minutes each one of those days. So I'm going to see if I can really amp up the weight loss a little bit with the use of the Carnitine and see what kind of effects I have there. And I expect all positive effects. But yeah, this is just the first supplement or prescription that I wanted to go over, just to kind of give some anecdotal evidence, as well as some, insight of what it's meant to do and what it does. Now, again, I'm not a doctor. I'm not saying that you should do this. Please talk to your doctor about your supplementation use, and maybe you could be a good candidate for L-carnitine, but always check with your physician first. But as an overall review of L-carnitine injections, it's relatively painless. It's not that expensive. It has great outcomes. It does wonders for sexual health, physical performance, fat oxidation, fat burning. And I would definitely suggest trying L-carnitine before you go on any other fat loss drug or prescription. But with that being said, my name is Gino. Thank you for coming on this journey with me, and I hope to see you guys in the next one. Bye.